So Richard, we've been talking on a couple of topics, but I wanted to talk about some conversations we've had recently about dental health. And this is off the back of, again, using probiotics for both short-term and long-term health. And how we're, with probiotics, how we're reducing organic waste in the dental area, in the sockets and so on. And most people know that there's a connection there with bacteria and plaque, which leads on to tartar, and then you can gravitate to gingivitis and periodontal disease and so on. So I wanted to talk about that, but also it'd be great to get your opinion on dental health in terms of organic waste in the mouth and the connection with organ health. So we're talking about a more longer term health protection. But what have your experiences been with that?
Joe, it's a really good question and really good topic, because I think it's a topic in our profession and in our world actually that's and that's the world of pet ownership that I don't think we generally have a very good handle on. Just to kick off my answer, just recently I had some dental issues of my own, and I couldn't get to a dentist for 4 days, and oh my word, the pain was so intense. I literally wanted to pull this tooth out with a pair of pliers. It's a kind of and for anyone who's suffered from dental pain, I'm sure they can relate to what I'm saying. It's just it's unbearable. It literally is unbearable. You can't get away from it. It's just terrible. So I must say, I've got a new respect for pets who seem to, even with advanced dental disease, just seem to get on with their lives without demonstrating to us that they're in a lot of pain. But they must be. So I'm really on the dental thing at the moment.
Okay.
But in terms of answering your question, I think it's a very good question. I think it's an under-asked and under-understood kind of problem. And that is basically that bacteria that naturally reside in the mouth. And there are a whole bunch of bacteria that are friendly bacteria that do a good job of keeping the gums healthy, the teeth healthy. The problem is if there is dental disease per se, gingivitis, the accumulation of plaque, the accumulation of tartar, loose teeth, missing teeth, ulcers in the mouth. When there's some kind of disruption to the normal oral health situation, then again the microbiome can rebalance itself in favor of pathogens. And that's a real problem, not only for dental health and the extension of gingivitis, which, as you implied, means that the bacteria start to eat away at the gum lining and towards the dental roots of the teeth, and ultimately can potentially cause dental abscesses at the roots of the teeth. But it's a perfect springboard for infections into the bloodstream, and once infections get into the bloodstream, these bacteria can circulate and end up anywhere in the body, literally anywhere. But common places that these bacteria go to are areas in the body that have high blood flow. So the kidneys, for argument's sake, the brain, the heart muscle. So actually, when presented with a patient with a kidney infection or a bladder infection or a heart murmur that's there because of an infection in the heart, or even some odd behavior, it is possible to trace those infections back to the mouth. And I think that's often a link which we just don't really properly appreciate. So actually, dental disease is a very, very dangerous thing to allow to happen. And again, it's generally not the commensals, not the friendly bacteria that make their way into the bloodstream and circulate, because the body has evolved over literally millions and millions of years to be comfortable with these commensals. So the body's immune system is primed to make sure that there's a harmonious balance between friendly bacteria and the activity of the immune system. It's when pathogens come along that it's a direct danger to the body, because a pathogen by its very nature challenges the immune response, and sometimes the immune response is found to be lacking, in which case the pathogen gets the upper hand and then can circulate and cause chaos anywhere in the body, thanks to the fact that the bloodstream is just taking them around the body. So again, without trying to overstate the case, it's a microbiome problem. It comes back to ensuring that we've got the right balance of bacteria in the mouth, and in the mouth, the back of the throat, the teeth, and again, like with skin disease, like ear disease, we have to unpick the problem and try and figure out what's caused it in the first place, because that's where the solution lies. And sometimes just the accumulation of dental tartar and plaque is the problem. It's just we've provided or allowed a house for potentially pathogenic bacteria to invade from. So sometimes the solution is just clean the teeth, get the teeth cleaned, to get the tartar off, get rid of that organic material,
which can be more difficult than it might sound.
I mean, it definitely. I mean, usually plaque is like a pasty stuff which you can scrape off the teeth with a nail. Tartar, the only way you can get tartar off is by scaling it off with a ultrasonic scaler. But in order to get into a dog's mouth without them biting you, generally we're talking about an anesthetic. I say dog, same applies to cats. Yeah. Generally we're talking about an anesthetic, and generally we're talking about an older dog or older cat with all the risks that go along with anesthetic procedures. So it's definitely a situation you would not want to be party to, or at least allow to happen. It's far better to be proactive before we get to that stage. But in terms of being proactive in keeping the mouth, the oral microbiome properly balanced, this is really where probiotics can be very useful to stop a situation getting worse, or just maintaining a healthy situation to start with. That said, if we find ourselves in an unhealthy situation where there's gum recession, loose teeth, tartar buildup, plaque buildup, applying an overwhelming population or biofilm of friendly bacteria, again, fights the good fight. Will literally compete with any pathogenic bacteria for the organic nutrients that are present in the mouth. So
you're removing those organic nutrients, i.e. waste from whatever the dog's been eating or licking. You're removing that with the probiotics. So you're reducing the attraction for the pathogens. Therefore reducing the pathogens, reducing the plaque and tartar, gingivitis, periodontal disease, and again connection to the blood flow into the organs, and that's the basis. So it's just it's an outcompeting, almost a mechanical process.
Exactly. So what a pathogenic bacteria needs to flourish is the right environment and enough food. So if the right environment is there, for argument's sake, if there's a lot of dental disease, dental tartar, and we've said the only way we can deal with that is to scale it off. But in addition to that element, there's also the element of, and effectively that's taking their food away. The next element is, let's overwhelm this mouth with friendly bacteria so that the friendly bacteria can compete with the pathogenic bacteria. And if we can skew the odds in our favor. which it's so easy. We just apply more probiotic.
Yeah.
It's a numbers game.
And this is almost the opposite to what we do as humans. We're taught to use antibacterial toothpaste,
Yeah.
and then floss.
Yeah, yeah.
Because you're flossing, I guess, to get rid of that organic waste. So what we're doing with the pets is that we're actually flossing wouldn't be very easy. So we're using the probiotics to get in there at microbial level, at molecular level,
Yeah.
and get rid of that organic waste.
Yeah.
So it's quite a simple process.
Yeah, because as you sort of intimating, the probiotics, the commensal bacteria, the friendly bacteria, they also need a place to be and a nutrient source. So we're facing a situation where we've got two different populations, friendly bacteria, unfriendly bacteria, both competing for the same nutrient source. They don't fight against each other, they fight for resource. So we can just stack the odds in our favor by putting just an overwhelming amount of friendly bacteria in there.
Yeah, and
let them fight it out.
This is a subject a little bit close to my heart, actually, because the funny story when the young vet telling me about my product after my cat had 11 teeth removed, and basically saying I should be using this, and I'm thinking, yeah, I should. If I'd have been using this, then there wouldn't be any gingivitis, and the cat would have been a lot happier, and would be much cheaper. So yeah, that was my funny story when it comes to the dental. But it kind of opened my eyes as to just how important, it's the gateway to the rest of the body. I guess.
Yeah. No, that's an anatomical and physiological fact. Those bacteria.
Another question for you, though. Sorry to cut across, but do you see a correlation with diet and dental health in a general sense? Because you see a lot of different dogs, I guess, and I know you record what you find in the dental care. What do you find on that?
Yeah. I would say that diet is the single most important factor in contributing to dental health or dental ill health. One of our things at Wylie's is our little passions is what we call species appropriate nutrition, and that's a very simple concept to understand, and that's simply understanding that our domesticated pets in the form of dogs and cats are carnivores from an evolutionary perspective, dating back millions of years. They have become physiologically and anatomically adapted to a carnivorous lifestyle. So you just actually have to look at a dog or cat and see that their eyes face forwards, their dentition is for catching prey, the length of their bowel is relatively short compared to herbivores, which need a much longer bowel to digest and extract the nutrients out of plant matter. The pH, for instance, of the stomach is different in carnivores to herbivores, and so on. There's a whole raft of anatomical and physiological adaptations which have occurred over millions of years. So they are quite simply, unarguably, carnivores. So from a veterinary perspective, we see a lot of clinical problems: obesity, diabetes, other hormone imbalances, thyroid disease, Cushing's disease, immune-mediated joint disease, IBD, skin disease, associated with feeding these carnivores non-meat-based diets, high carbohydrate diets. So these are clinical problems we face every day. And they're nutritional problems. So that's one of our particular little things at Wylie's, and we can discuss that all day and all night. It's an ongoing debate, but that's where we stand on this. So from a dental health point of view, we find that feeding these carnivorous pets a species-appropriate diet, a diet that's principally made up of meat and fat and is raw, helps to keep the teeth as they should be,
And that's just your findings, right? That's your
100%,
record.
100%. We're not making this up. This is what we see in our consulting rooms, and have been doing so for the last 20 odd years.
And you and I have had some other conversations about skin issues and ear issues, and particularly with the skin issues, would you draw the same connection with the diet and the skin problems?
Yeah.
From your records and your experience?
Completely. I mean, some of those diseases that I've just mentioned, depending on the history, the clinical examination, we will make an assessment in a given case as to whether we think that the underlying problem is nutritional or not. Mm-hmm. And if we do, then often what we'll do is we'll suggest a raw meat-based diet. Mm-hmm. And I would say 60 to 70% of the time, those problems just disappear. They literally just disappear. So we see them back 3-4 weeks later, problem solved. Okay. Whatever that problem was. I have to say in the same breath that it's not a panacea, it's not a cure-all, but it's a very good start to a lot of the modern day diseases we see.
But you might say there isn't any one thing that's a panacea, cure-all, right? It's going to be, you can get really, really good results, but there's no such thing as a 100%, And I guess especially there's so many other influences. Yeah. It's, diet's principle, but there's other influences as well, which you can take a longer time. If they've taken a long time to build up, they can take a while to build down. Yeah. Super.
No, that's been our clinical experience, that the nutrition side is a key part of our pet's health, and it's like that. That's no great revelation. We all know that, right. If we eat unhealthily, we get unwell.
So basically, we were talking about probiotics, and I'm thinking, the diet's got to be looked at, always got to be looked at, and make sure that everybody's comfortable with that. And then putting the probiotics into the mouth to just, as we say, outcompete the bad bacteria. Yeah. Remove that organic waste that's going to be in there. Yeah. In a preventative action. Yeah. Kind of way, leads to longer health. Yeah.
Yeah. No, for sure. It's I think the probiotic bit, the purest raw feeders would say my dog just needs a meat-based diet and bones to chew on. I think that's slightly too narrow for me personally, because as I've mentioned before, if a dog walks into my room, I see a little microenvironment consisting of the dog, the cat, whatever, together with 20 to 30 trillion bacteria. So without actually taking account of those bacteria, I'm not actually seeing the full picture and not making my clinical decisions based on the full picture. So even in raw-fed, perfectly healthy dogs and cats, I still think there's a place for probiotic therapy supplement.
Yeah, brilliant. Listen, that was really, really interesting. Like I said, the dental is close to my heart, literally, because that's been proven. Yeah. But thanks very much for all the information, Richard. Absolutely brilliant.
Thank you. It's a pleasure, Joe. Absolutely, anytime. I love talking about this.
I know. Me too. We could go on all day. That's great. Thanks.